If you're looking for maybe a simple way to understand a really key health marker, well, you're definitely in the right place today. We're going to dig into the cholesterol blood test, the one your doctor might call a lipid panel. And we're using a great guide as our source today. It's from bloodtest.co.uk, which focuses on services, especially for those maybe in Wilmslow or Cheshire.
Exactly. And our job really is to break down this essential checkup. We want to show you exactly why knowing these fairly simple numbers is so crucial for your heart health. It gives you that benefit, that control.
Okay, let's get into it then. When they take that little blood sample, what are they actually searching for?
So they're measuring lipids. That's just, different kinds of fat floating around in your blood. The main ones people hear about are LDL. That's the bad cholesterol because too much can clog up your arteries.
Right, sticky stuff.
And then there's HDL. That's the good cholesterol. Think of it like a little cleanup crew, taking excess fat away.
Makes sense. Now, the guide, it really stresses fasting for 9 to 12 hours. That seems quite a long time.
Yeah.
If cholesterol's always there, why skip breakfast?
That's a really good question. The fasting, well, it's less about the LDL and HDL directly and more about getting a true reading on something else, triglycerides.
Triglycerides. Okay.
Yeah, another type of fat, and the levels of those can shoot up right after you eat. The guide over at bloodtest.co.uk points out that high triglycerides are a really big risk factor themselves. It means your body might be storing extra energy as fat.
I see. So fasting gives a baseline, not just the result of your last meal. Especially important for doctors, say, in Cheshire, trying to get the true picture.
Precisely. You want the real baseline number.
Okay, so checking these numbers, it's obviously a huge benefit then. They're key indicators for, serious stuff like heart disease and stroke risk. So before we get to the numbers, remind us about prep again.
Right. Preparation is simple but vital. Fast for 9 to 12 hours beforehand. Water is okay, but nothing else. And definitely tell your doctor or the clinician about any medicines or supplements you're taking. That's important.
Got it. Okay. Results time. What numbers are we aiming for? What's a healthy goal for that total cholesterol number?
For total cholesterol, the general target is to be under 200 milligrams per deciliter. Think under 200.
Under 200, okay. And what about the specific ones, the LDL and HDL? What are the targets there?
So for LDL, the bad one, you want that nice and low. Less than 100 milligrams per deciliter is the ideal target.
Less than 100 for LDL?
Yes. And what's really interesting, something the guide highlights, is that even just lowering your LDL by, say, 10 points, consistently through lifestyle changes, well, that can cut your overall cardiac risk significantly over just a few years. That's a massive benefit from what might seem like a small number change.
Wow, okay, that really shows why keeping an eye on it matters.
Yeah.
And the HDL, the protective one.
That one you want high. 60 milligrams per deciliter or even higher is considered really good. It means that cleanup crew is working hard, protecting your heart. Monitoring these numbers really empowers you, and local experts, like those in Wilmslow, they definitely see how routine screening, like discussed on bloodtest.co.uk, really helps people's long-term health in the community.
Absolutely.
Yep.
So let's talk action. Someone listening, maybe in Wilmslow, needs this test. Where can they actually get it done? And why is doing it regularly so vital? Can't you just do it once?
Good questions. Access is usually pretty straightforward. Your local GP surgery, private clinics often offer it, sometimes even pharmacies in the area. But the regularity, that's where the real benefit comes in. We usually say every 4 to 6 years for most adults.
Okay.
But much more often if you have other risk factors, things like diabetes, high blood pressure, family history.
Right, makes sense.
Because your body changes. Your levels aren't static. Regular checks give you like a moving picture as your personalized health roadmap. And seeing those numbers, well, it motivates you to make changes now.
How so?
Well, if you see your LDL creeping up slightly, knowing that early helps you think, okay, maybe more exercise this week, or I should swap out some of those processed snacks, or maybe add more oily fish like salmon for those omega-3s. The stuff mentioned in the research section on bloodtest.co.uk, that specific knowledge, your own numbers, it's way more powerful than just general advice. It's about preventing problems, not just reacting later.
That really is the core message, isn't it? Knowing your cholesterol numbers is such a powerful first step towards managing your own health proactively. It's like having an essential tool.
It absolutely is. It gives you that personalized plan. So, thinking about that, since your latest levels kind of give you a specific goal to aim for, here's something to ponder. What's maybe one simple change, just one thing in your diet or exercise routine that you listening could commit to right now? Something to help make sure those numbers look great before your next checkup.